Good afternoon, everyone. My case is a rare case of lightning-induced unilateral total cataract presenting within 24 hours. No financial interest involved. A 12-year-old boy presented with sudden loss of vision in the right eye a day after sustaining a lightning strike. Examination revealed superficial burns to his left arm, left and right lumbar region, and a dense cataract in the right eye. There was no evidence of other ocular manifestations, and his left eye was normal. Lightning-induced cataract progressed very rapidly and can also involve the posterior segment. Keeping in mind the implications of lightning on visual outcome, we report a case of an isolated unilateral pediatric cataract due to lightning. Lightning-induced cataracts are rare, and much more rare is people escaping death in such situations. So there is a high probability of such cases going unreported. The chances of being struck by lightning in a year is about 1 per 9,60,000. The resultant manifestation of lightning injury is due to either mechanical disruption or due to localized inflammation, which is secondary to high energy transfer in the form of heat or electric current. Cataract is the commonest ocular manifestation of a lightning strike. Injuries due to lightning has been reported in various literature such as keratitis or uveitis in anterior segment, retinal detachment, papillitis, and macular hole formation in the posterior segment. Coming to our case, a 12-year-old male student from Hazaribagh presented to the IUPD with chief complaints of diminution of vision in right eye since one day. According to the patient, he was apparently well one day back and was grazing cattle in an open field. It was at this point of time a lightning thunderstorm struck nearby him around 20 meters away and he went unconscious. Patient's father further said that they took him at a local clinic for primary treatment and from there he was referred to our hospital. After the patient regained consciousness, he started complaining of diminution of vision from right eye. There was no prior history of any serious illness, poor vision, ocular trauma, or red eye. The patient had a normal term at birth at term, thoroughly immunized with proper developmental milestones. Personal, dietary, family, drug, and other systemic history were insignificant. On general examination, the boy was conscious and well oriented to time, place, and person. Vitals were stable and findings of systemic examination were within normal limits. Local examination revealed a superficial burn wound on the medial side of the left arm and a superficial burn wound on the lateral side of the left and right lumbar region. These are the classical filigree burns that was seen in that patient. Coming to ocular examination, the best corrected visual acuity of the right eye was 6/60 and the left eye was 6/6. The extraocular muscles, eyelid, eyebrow, eyelashes, conjunctiva, cornea, anterior chamber, and iris were within normal limits in both the eyes. Pupil was round, regular, and reactive in both the eyes. IOP Goldman measured IOP was 17 and 50 mm of Hg respectively. The lens of the right eye was cataractous while the left eye was transparent. On post-dilation, the slit line examination showed a dense cortical cataract in the right eye and the fundus could not be evaluated due to opaque media. The disc was just visible. B-scan and optical coherence tomography also revealed no abnormality. The patient was informed about the status of cataract that has occurred after sustaining lightning. The patient was advised for cataract surgery of right eye with IOL implantation and was counseled for the risk of amblyopia. However, patient was lost in further follow-up. This is a photo showing the dense cortical cataract in the right eye and the fundus of the right eye. Lightning-related injuries are more common in developing countries. Lightning has been known to cause cataract for almost 300 years. Unfortunately, there has been no conclusive studies on the incidence of cataract amongst lightning victims. It is rare for a child to survive lightning and rarer to develop an isolated unilateral cataract. Cataract development has been recognized to occur immediately, but more commonly has a latent period of 1 to 2 years. The pathogenesis of cataract following lightning has been attributed to either decreased permeability of the capsule or due to concussion due to excessive contraction of ciliary muscle or due to scar tissue formation with hyaloid deposition in anterior capsule leading to disturbed lens nutrition. These cataracts generally progress to maturity quickly, and so it is common that many such cases present as total cataract. Thank you.